right answer, though. You know, it's just, it is.
Okay, so we are 1 year into Trump's second term. What is your assessment so far?
Well, I think for families across the country, this year has meant that people are paying more and feeling less safe. They're directly because of policies put in place by Donald Trump and Republicans in Congress. Prices going up about $2,000 a year for families in Washington. Housing, food, healthcare, childcare, energy costs, all going up. Republicans promised to lower costs, but it's been clear that it's been a big broken promise this year. So it has been devastating for working families. We can absolutely do better.
What have you been hearing about inflation for consumers right now?
Well, consumers are struggling, and a good chunk of that is because of policies put in place by the administration, and definitely tariffs. Tariffs have been paid primarily by Americans. 96% of the people who are of the tariff, of the revenue from tariffs, is coming from Americans, from consumers and small businesses. And so this isn't about helping our communities, about lowering costs. It's had a direct impact here. We are a state that also exports a lot, so it's taken away markets from some of our producers. And for no reason. Congress needs to have a say here. The Supreme Court should be deciding, hopefully soon, about whether or not the administration can be using the authorities they are to put these tariffs in place. I don't think they can. I don't think they have the legal authority to do this. Congress has an important role to play, and Congress should be voting on this. And that should be bipartisan. It used to be, but somehow Republicans are silent now that Donald Trump's in charge.
I know you're in the minority, but are there any plans to attempt to change the regulations the administration is using with all of these tariffs?
Well, I think, one, folks are waiting to hear from the Supreme Court, but we are going to continue to push to make sure that Congress has a vote. If Republicans think that what he's doing is a great idea, then put legislation on the floor and vote on it. They are in the majority in the House and the Senate. They could pass it if they wanted to. But this has been devastating for families. Congress has an important role to play, and we should be making sure that we are clear the president does not have these sweeping powers.
What have you learned about Medicare using AI to deny claims? How extensive is this?
So in Medicare Advantage, many folks have struggled and will understand the struggle they've had with something called prior authorization, which has kind of given insurance companies the position where they get to decide whether or not you can get a certain procedure or get certain types of healthcare coverage. Prior auth has delayed care, it's denied care, it's made things harder for families and for doctors. And so now, instead of making sure that we are clear that that shouldn't be happening, that people should get the health care they need in conjunction with their doctor, now the administration is proposing using kind of more of these AI models to decide whether or not you should get covered for health care. And one of the pilots for this is happening in Washington State. Again, it's critically important that people get timely care, affordable care, and that doctors are making decisions, not AI models that may or may not know what your situation is. So we're fighting against this, fighting against it with the administration, and doctors need to be able to work with you to make decisions on what's best for your health care.
I want to ask about ICE. I know there's a bit of division within the Democratic Party when it comes to ICE funding within the DHS spending bill. Where do you stand on that?
Well, what we have seen from ICE across the country and also what we saw happen in Minnesota has been horrific. They feel like they have no need to follow any rules or laws. There need to be important guardrails and there needs to be accountability. And that needs to be very clear. That should be a common effort, a bipartisan effort. And again, Republicans don't seem to be willing to come to the table. So when we talk about a funding bill, we've got to make sure there are guardrails and the rules in place. Things like body cameras or warrant standard or standards around the use of force. All of those need to be there. We don't have all of those things in place that I think need to be there in order for us to continue to move forward on legislation.
You're the D-Trip chair, of course. How are you feeling going into this midterm right now?
Well, the American people are feeling the damage being done by this administration. People want leaders who are going to stand up for them. And so you see across the country, more and more people have continued to say, we want representatives who are going to stand up for us, a Congress that considers itself a co-equal branch. And we've been running ahead in elections all across the country. And we're going to continue to see that. We only need 3 more seats to take back the House, and we will take back the House in November of 2026.
I'm going to go back to ICE really quickly. I have a follow-up. Have you considered any legislation about ICE and their activities, or are you just kind of waiting what's in the DHS spending?
Well, I think it is critically important that there's accountability. We need to make sure that there are investigations, and Democrats have initiated investigations into ICE. This should be bipartisan. They should be held to rules of conduct. Republicans said they were going after the worst of the worst. We have children and seniors, American citizens who have folks with masks on coming in, raiding, detaining people with no due process. That is not our system, that's our law, and that is not what people voted for.
Anything that you're working on that you want your constituents to know about?
Continuing to work to make sure that we are addressing the issues of affordability across the country, on housing, on food and healthcare. Number one issue we hear from folks in our community, but frankly across the country.
Is there anything else you want to add?
No, I think we covered most of it. Thank you.